Our initial focus with Deniz will be on directly tackling her current challenges, rather than extensively exploring their origins. Because understanding cognitive behavioral therapy is crucial, we'll begin by explaining the CBT model to Deniz and how its techniques relate to why her difficulties started and continue. This understanding helps people stick with therapy and, importantly, equips them to use CBT strategies on their own in the long run, leading to lasting improvement. Exposure therapy, a key part of CBT for social anxiety disorder, helps individuals change how they think and feel about feared social situations by gradually facing those triggers. This process directly tests and challenges what they expect will happen and how bad it will be in those situations. Our goal in therapy with Deniz is to help her get used to situations she currently fears but are actually safe, so her anxiety decreases in them. This will involve in vivo and imaginal exposure exercises, potentially including virtual reality along with homework assignments between sessions. Deniz and her therapist will have an open discussion to realistically estimate the number of sessions needed to reach her goal and the length of each session. They've decided on 10 sessions, each lasting 45-60 minutes. In session 1, we spent some time with Deniz talking about how she viewed her social anxiety. We explored Deniz's strategies on emotional regulation. For example, did she reappraise her emotions or suppress them, using the emotion regulation questionnaire? This provided insight into Deniz's coping strategies, as well as painted a fuller picture of Deniz as our client. We ensured she fully understood the purpose, scope, and content of the questionnaire, being mindful of any potential barriers to her comprehension. Should any challenges have arisen, we were committed to addressing them with a trauma-informed and anti-oppressive approach, ensuring her comfort and understanding throughout the process. At the end of session 1, we explained to Deniz what the subjective units of distress scale was and its purpose, and we asked that she compose one for session 2. In session 2, we discussed Deniz's answers to the emotion regulation questionnaire, which tied into Deniz's reactions to her anxiety brought on by social interactions. We also discussed some of Deniz's physical safety behaviors she relied on when she felt anxious in social situations. For the situations she could not avoid altogether, Deniz might rely on avoiding eye contact from the other person. She took out her phone and pretended to look at messages. She might fidget with her bracelets or jacket buttons. She only responded quietly with minimal words, or even just shrugged her shoulders. And she sometimes hummed quietly to herself. We discussed the subjective units of distress scale she completed and decided for her homework before session 3 to select something she could work on that was minimal to mildly distressing for her. Deniz thought she could walk through the park over the next few days or make plans with a few of her close friends and actually follow through with it. In session 4, and all subsequent sessions after this, we debriefed about how her homework went and if we felt safe to move up Deniz's size hierarchy. With her consent, we discussed opportunities where Deniz could talk to a stranger. She said she could walk to a nearby market to buy groceries and use the cashier to check out rather than the self-checkout lane. We used session 4 to rehearse what the interaction might look like. We planned out how long the entire interaction might last and how she could suppress some of her usual safety behaviors she used to alleviate her anxiety. Deniz decided that she would make eye contact for 1 full second with the cashier and refrain from looking at her phone during the interaction, but she could hum to herself if she felt her anxiety building. After the in-session imaginal exposure, we discussed any anxiety-related distorted cognitions that may have come up for Deniz and discussed how that could be reappraised. Over the course of the next few weeks, in sessions 5 through 8, we moved up Deniz's hierarchy. Deniz's birthday party took place during these weeks, where she offered to call the restaurant to make reservations, and during the call, she was to make one specific request to the staff. She also went to the mall during busy hours and spoke to a store clerk to purchase a new outfit for her birthday dinner. We did in-session roleplay so she could rehearse what she needed to say each time. We introduced virtual reality exposure for when she would need to remain standing, while her family and friends sang happy birthday to her in the middle of a crowded restaurant. Deniz felt she might even try to say a few words of thanks while standing. In session 9, Deniz had been doing exceptionally well, and we continued to use virtual reality with her to prepare for the upcoming university BBQ. Deniz said her SUDS hierarchy had shifted since therapy, and interactions that used to give her moderate to strong anxiety, such as going into a busy store now, only gave her mild to moderate anxiety. She had not been using her safety behaviors as often, such as humming or fiddling, still had some discomfort with sustained eye contact during conversations, no more than 5 seconds, but was overall feeling like she had control over her anxiety. In session 10, about 15 weeks after starting therapy, Deniz had been working hard on her organic chemistry presentation. She had been attending classes and labs in person at the university. The BBQ event went better than expected, having talked to more than one new person while there. Deniz was very proud of being able to hold several conversations with new people and not using her phone as a safety behaviour. She said because she attended classes in person again, she saw more new faces, and therefore recognised a lot more people at the BBQ, which made it easier to talk to them. One of her biggest fears was getting recognised as the girl who fainted, but she found most people either forgot about the incident, or if they did recognise her, they were very empathetic and kind about it. We used virtual reality to prepare Deniz for her presentation and discussed any anxiety that came up. Deniz also practiced in front of her small group of friends as homework. Deniz felt after 10 sessions, she had been able to change how she thought and felt about social situations and public speaking. With practice and preparation, Deniz's anxiety had decreased significantly and believed that she could get through her presentation without any issues. Deniz decided to debrief about her presentation either over the phone or by email with her therapist, as she had a family vacation planned, something she had not been able to do for almost a year.